question, Paulina.
Okay, would you go ahead and just kind of get started with the...
Yeah, let's get started.
All right.
Okay.
Okay,
I'm on. Good morning, everyone. Welcome to the Fort Collins Virtual Community Conversation. This is actually the second one that we've done using this Zoom meeting webinar platform. And we have, at this point, we have about, including the four of us who you can see, we have about 15 participants. And again, the goal is to provide folks with an update about our Census 2020 work, as well as what's happening with the county related to the regular operations of what we do as a county government, and certainly all of the things that we're doing related to the COVID-19 public health situation. So at this point, I'd like to turn it over to Paulina. She can introduce herself. She'll provide some instructions of how this will go, and then maybe the other two folks can introduce themselves, and then we're going to have the person on my lower right. I feel like I'm in Hollywood Squares here. I imagine Emily, or maybe doesn't know what that was, or but maybe she does. In any event, Paulina, would you tell us who you are and give us some instructions, please?
yes, so my name is Paulina Bennett, and I work for Larimer County in the IT department. I've been helping kind of assist with some of the Zoom meetings here from more of a technology standpoint, so I will be somewhat moderating this meeting today. But really, this is a webinar Zoom meeting. So if you have been in a Zoom meeting in the past, it might be a little bit different than what you're used to. So this meeting is a webinar, and what that means is that we have panelists and we have attendees. So you can see the four of us in these blocks right now, and we are all panelists. So that gives us the ability to mute and unmute ourselves when we need to, and also to see our faces. As an attendee, it's a little different. So you don't have the ability to mute and unmute yourself unless we give it to you. So we want this to be really interactive, and we want it to be fun. So what we ask is that if you do have a question, or you would like to comment or anything at all, simply raise your hand. There should be a raise your hand functionality on your screen. And if you're only calling in, so if you are only calling in on the phone, you're going to press *9 to raise your hand, and it does the same functionality. So either press the button on your screen or *9 for the raise your hand functionality. That'll let us know you want to ask a question or you have a comment. In addition to that, we also are already seeing a lot of Q&A happening in the Q&A section of the meeting. So feel free to put your questions in there as well. We're more than happy to take questions that way as well, and we'll be answering them throughout the conversation. So if you need anything, let us know. I'm here to help from a technology standpoint and to support the meeting in any way that we can. All right. Go ahead.
Okay, I guess I'll introduce myself next, if that's okay with Commissioner Kefalas. I see a lot of names I know on the participant list, so hello everybody. My name is Michelle Bird. I'm the Public Affairs Director for Larimer County. I am actually here today because I'm learning from Paulina, since we kind of don't know where COVID crisis is going to lead us in the future. We don't want Paulina to be the only one who can host these online type of meetings. So I'm really just going to be in the background today, helping Paulina if I can with questions and answers and raising hands and things like that. But I'm really here today just to be an observer of how to, learn the technology and moderate the meeting. And maybe if there's questions I can answer, I'll go ahead and do that too. So good morning, everybody.
And I will go ahead and introduce myself. I am Emily Darrell, the Regional Census Coordinator for Larimer County, and I'm just here today to provide a quick reminder about the census and how important it is that it's going on right now, and to just give an update of the impacts that your response to the census can have on our community. So good morning, everyone.
Good morning, Emily, Michelle, and Paulina, and good morning to the participants. Again, including the four of us right now, we have about 17 folks. There are some questions in the Q&A, but what I'd like to do is turn it over to Emily, give her the first chance to provide us with an update of her work, Maybe, Emily, you could also provide some context about how your position came about, where the money came from to do the work you're doing, and then, take it from there, of course.
Absolutely. So I'm here as a result of a grant that Larimer County received from DOLA, the Department of Local Affairs with Colorado, which we received to promote the census and get the word out about the census, because really the census has a broad financial impact for our county, and it's something that is essential to a variety of services, from healthcare to human services to infrastructure, et cetera. So that is part of why I'm here, and I will be working to hopefully promote the census in our communities through the end of June. So I'll just get started providing a little bit of information about the census. Right now, especially, it's very important because it's something that you are able to do safely from the comfort of your own home. It takes about 10 minutes. And you can do it without being around a lot of people, which is super relevant during everything that's going on right now. For those of you who may not know, the census is basically a population count that comes around every 10 years. The census likes to count everyone who's living in the United States at that point in time. And so everyone living in the United States, that includes babies, if you're a citizen, if you're a senior citizen, if you're a college student, what have you, literally everyone wants to be counted in the census. The info that the Census Bureau receives is then used to determine where approximately $675 billion in federal funding is allocated over the course of the next 10 years. So you really have one chance to determine where all of that funding is going to go for the next 10 years. In Larimer County, we did the math, and what that amounts to is around $800 million each year, which per person living in Larimer County is approximately $2,300. So if you want to quantify in monetary terms what your census is worth, it's a pretty good chunk of change there. And many communities, including our own, rely on these funds for things like healthcare, emergency services, which of course is on everybody's minds right now, but also things like education and housing and transportation and employment. And so this, again, it only comes around every 10 years, and we're really trying to get the word out that it's easy, it's safe, it's important. Takes about 10 minutes to complete, and there's about 10 questions, which range from what is your name, what's your age, your sex, your Hispanic origin, your race, and your relationship to a central person in the household, and where you live most of the time. So you want to make sure that you're completing the census for whichever location where you spend most of your time. You can do so by going to 2020census.gov, and you can learn more about the census. Say you're concerned about security of your information, or if you just want to learn about how to get the word out to other community members, you can absolutely go there. And that's sort of a one-stop shop for all of your census information needs. It's in 59 different languages in addition to English. And in addition to that, they this year have a phone line that you can use. So if you call 1-844-330-2020, they also have live staff available. It's practically 24 hours a day, but I think it's from like 7 a.m. until almost 3 a.m. And you can respond to the census that way too, or ask questions. So that is my census spiel for the day. And I just want to make sure that everybody knows it's going on right now. And they have until, I think they've extended the deadline to self-respond until the end of October, tentatively. So you have time, but what better time than the present? Thanks.
Emily, we have a question on here from a census worker.
Yeah.
Do you know anything about the training for census workers?
That's a great question. I do not specifically know about the training for the census workers themselves. I do know that things have been pushed back, and I don't think that they're anticipating the on-the-ground operations are going to begin again until around June 1st. That was the last that I heard for census field ops. That being said, I can ask our regional partnership specialist if she has any updates about that, and I can post something. We have our own Larimer County Census webpage too, and it is larimer.org/census-2020. And so I can post some info there or follow up via email, whatever works best. And I don't see.
Are there other questions for Emily?
I don't see any, and if I am missing them, I will make sure I come back to it, but I don't see any other.
Yeah, Emily, you'll be able to stick around, won't you?
Yeah, absolutely. I'll be.
And actually, I have a question or two. I don't want you to get off too easy, since I imagine that I won't get off too easy. But I'm wondering, in terms of your collaboration with the municipalities and other stakeholders in this process, could you talk about that a little bit? And also, what specific efforts are we doing to reach harder to reach folks? For example, people in rural areas who may be isolated, older adults, people who speak other languages who might have some trepidation about participating in the survey. Could you speak to that, please?
Yes, I'd love to speak to that. So we do have some harder to count communities, as you said, including a large rural population and a large population of individuals whose first language isn't English. So what we've done is we've partnered with, or we've attempted to partner with some of the agencies who are in these like rural communities, for example. So I think we have good connections with the libraries in these areas. This has been complicated quite a bit, as you can imagine, due to the COVID shelter in place. Initially, we were going to go out with our tablets and help people register, or not register, but complete the questionnaire directly. And now that we have to social distance, that's not our reality. So what we've been trying to do is trying to get the word out. We have a weekly newsletter that goes out to all of these communities about how they can spread the word about the census. We, each community or municipality, so I think we have a Fort Collins Complete the Count Committee, we have an Estes Park Complete the Count Committee, and a Loveland Complete the Count Committee. And that consists of a variety of human services, social services, local business organizations in those areas who are helping to promote the census. So for example, in Fort Collins, we have partnered with Volunteers of America, who they're going to include little snippets about the census in their phone calls to their population, the majority of which is senior citizens or individuals who are older. We also are partnered with the Early Childhood Council of Larimer County, and they have been putting information in the, the meals that are going out to children who are no longer in school and the families. We have census information that's included there. And we're also partnered with an organization, Alianza Norco, and they provide advocacy for Spanish-speaking communities and immigrants. And they've been doing a lot to get the word out about the census, whether that's including census flyers that are bilingual with the masks that they're providing for their population, or hosting events that have information that's relevant to that community, like licensing is a big subject, and they then include a spiel about the census. So we're partnering with as many communities as we can in these hard to count or historically undercounted communities. And we're just trying to continue establishing those relationships and creatively communicating about the census any way we can.
Thank you, Emily. That's great. And one last question, if I may, from me, and that is,
yes,
unless I missed it, what are the implications for, well, two questions. One is, how is Larimer County doing in terms of our self-response rate compared to the state and compared to the, perhaps to other counties, your neighboring counties, et cetera, in the region? Because I know you, in your newsletter, which is a weekly newsletter, and you might want to let people know how they could subscribe to that, as if they don't get enough emails already. But how are we doing? And also, what are the implications for getting an accurate count as it relates to congressional redistricting and state legislative reapportionment?
That's a great question.
There are two questions.
Okay, our rate in Larimer County is sitting, I think as of today, it's right around 61.2%, which is pretty good. That's better than our nation as a whole, which I think is hovering around 55%. That being said, I think we're the 10th county in the whole state in terms of our self-response rate. So we're up there, but we're not like in the top 5, say.
What's the goal? What's the goal?
Great.
What's our goal? 90?
Our goal is 90.
100?
We want
Pardon?
90%.
Huh.
So we're edging towards that. I think I also learned that the rates of self-response compared to in 2010, for example, we are on for that in terms of our rates of growth, which is great, because I think we all were a little worried with the shelter-in-place restrictions, not having people being able to go out into the community and say, hey, complete your census, that might really hinder us. But it looks like we are well on track in terms of that. And yeah, those results, they absolutely will be used to determine the redistricting. In terms of what that is going to look like, that's something that's a little more complicated than I'm able to understand. I think that the Census Bureau has determined that they're going to actually extend the timing for that. Normally they have, I believe it's until something like April the year following, whenever the census is completed, to determine that reapportionment. But this year, I think they've pushed it back a little bit more, since they're pushing back the self-response, their own determination of the calculations and things like that, that they need a little bit more time. And so it looks like there's another question that I got too about, can you speak about the paper census response? If I adequately responded to those 2 questions, I'll move on and answer that quickly. They have sent out paper census copies. That's something that should have happened in most areas to all households, except for those rural households who have P.O. boxes or are otherwise inaccessible due to terrain, or they're just how remote they are. And the census arriving via paper is still an option. You absolutely can complete the census via paper copy if you're more comfortable with that. We don't recommend you complete the paper copy if you already filled it out online or if you responded over the phone, but you can just fill it out and send it back in the mail. There's no postage necessary. You can just pop it in your mailbox or bring it to a post office, which most of them are still open. And so that's, as always, the traditional and a well-accepted method of responding to the census. I will say, for those rural communities that have P.O. boxes and haven't received any mail, what they're saying is that you can still respond to the census over the phone or online if you would like, if you haven't received anything, unless you meet a few requirements. And now this is where it gets a little bit tricky, because what they're saying is, if you don't have a city style address, which means you have a street name and number, and if you receive your mail via P.O. box or something, and you haven't received anything from the census and you are rural, they are encouraging you to not respond until somebody brings a census copy to your door. And that's because eventually someone's going to need to come to your door anyway, and the Census Bureau doesn't want to lead to further confusion where someone says, oh, actually I completed the census. Why is somebody here at my house? So we're also attempting to get that message out, that in some very rare circumstances, if you haven't received anything in the mail, there's probably a reason for it, and maybe just hold off and don't complete your census quite yet. So I hope that answers the paper questionnaire question. Anything else? Thanks so much for letting me have this time. I really appreciate it.
Absolutely, Emily. And so now let me just give a couple of highlights regarding the county. And then there are at least a half a dozen questions in the queue that could help frame our discussion. First of all, this is the second virtual community conversation that we've done. The first one was on April 23rd, a Thursday, and the target audience there was Red Feather Lakes. Paulina was wonderful in terms of helping in the role that she's helping us with today. We had Reagan Cloudman, who's one of the public information folks from the U.S. Forest Service, our district, talking about outdoor recreation opportunities and some of the limitations. So that was a well-received community conversation. And that came about because there were some issues raised about campgrounds and bathrooms and all of that. And so even though it had originally been canceled, we decided to try this format. And so far it seems to be working okay. We actually have another one scheduled for Thursday, May 7th, I believe that is. And that's the normal time when we would be having our Wellington community conversation at the T-Bar Inn. And I look forward to being able to go back to the T-Bar Inn, but we're not quite there yet. And we can certainly, we'll talk about that as far as businesses reopening and the safer at home phase of our transition that we're in. Emily will also be participating in that one and provide similar updates regarding the Census 2020. There we're targeting through our email outreach list, which we often get because Alicia in our office keeps those from the sign-up sheets and other ways. But we'll be targeting folks from Wellington, Buckeye, Waverly, and LaPorte, since we will be canceling the LaPorte one at MeOMI. Although I would encourage you, they have a great online ordering system, and they have great breakfast burritos, and really, really encourage you to try to support local businesses as much as possible. So we're going to continue in this format, some cancellations, and then we'll see what June brings us. And I frankly, on the Fort Collins community conversation, I look forward to gathering with folks in the proper distancing in the patio, for example, at Dasbog Coffee. I'm sure they could use our business. So with that said, let me just say that I think the first reported case of COVID-19, positive case diagnosis was March 5th. And immediately within a couple of days, our Office of Emergency Management, ably headed by Lori Hodges, they sprung into action. Most of their experience is related to natural disasters like the Hyde Park fire in 2012, like the floods in 2013. But basically their job is to bring everyone together and set up what we call an emergency operations center. And that emergency operations center has been, I think we've been in this about 54, 55 days. And they're the ones that coordinate all of the various aspects with, with hospital, healthcare providers, law enforcement folks, a variety of other people. So the county, one of the big responsibilities of the county is to operate the Emergency Operations Center. And then within that, we have something called the Joint Information Center, the JIC. And that's really important. And all this information is on our county website. If you go to larimer.org/health, and then that'll link to the COVID-19. And there's an awful lot of really, really, really public health, business-related information, information for communities, of faith and worshiping and those kinds of things. But we sprung into action within a couple of days of the first reported case. The commissioners, we determined that we were in an emergency situation, and we made a declaration. The state made a declaration that allowed us to be able to access federal dollars easier. So that's one of the important roles of the of the county related to COVID-19. Of course, our public health department has been on the front lines, Tom Gonzalez, Katie O'Donnell, and they're basically the ones that, based on science, data, modeling, best practices, they're the ones that are informing the commissioners, and ultimately we do the best we can to make decisions about, for example, the county issuing its own stay-at-home order that expired, that ended April 26th, last Sunday, similar to the state's stay-at-home order. So that's, they're the ones that are out there monitoring. They're the ones that are making sure that we're keeping track of the new cases. Currently, I think as of yesterday, we typically update the website at 4 o'clock on a day. We're up to about 377 diagnoses or positive cases, 19 deaths, 3 outbreaks, although I think the state says we have 4 outbreaks. An outbreak is defined as 2 or more folks in a particular location. And so we keep track of that. And just as important, and perhaps even more important, we also keep track of hospitalizations. One of the reasons that we converted the ranch out there in Loveland is to establish an alternative care site, is basically to help us deal with any potential medical surges, especially as more and more people are going out in public, and even though they still are required or are encouraged, recommended to practice important public health protocols. But the ranch, the alternative care site, which is basically ready to go should it be needed, was to help if hospitals in the region were at capacity or were at exceeding capacity, in particular in their ICUs, folks who were coming out of the hospital with less acute symptoms, they could go to this alternative care site and be taken care of there. So that's another important role for the county. I think I will, and the last thing I'll say is then I'll start to respond to the questions and we can open it up for more questions. The last thing I wish to say is, I'm just mightily impressed by our team, Michelle, Paulina, Emily, our health department folks, our emergency management folks, our law enforcement folks. Ultimately, we're in this together. And frankly, even though we don't get it 100% right, 100% all the time, there's a lot of really, really incredible stuff. And if you compare the numbers between Larimer County and our neighbors to the east, you can see that even though it's been hard for folks, the stay-at-home order was not just based on somebody having a bad hair day. It was based on modeling, projections, epidemiological, science, and all of those kinds of things. And I think that Larimer County is one of the best counties in the state, Front Range counties in particular, in terms of the number of cases that we're dealing with, in terms of our hospitals being able to handle folks, having some of the supplies, even though we still don't have all the supplies we need. But we are doing I think we're doing a very good job. And these folks deserve an awful lot of credit. I wanted to make the point, while a lot of our attention is focused on the COVID-19 public health crisis, and we're far from done with this thing, county government still works. I mean, we're still doing the regular stuff that we're supposed to be doing. We've had to adjust. The buildings are closed. There was a question regarding elections and election judges. I can try to speak to that, but I think ultimately we're going to have to follow up with Angela Myers, who oversees the elections, the June 30th primary elections. But we made the decision to close the buildings in alignment with the state guidelines and the stay-at-home order. And now we're we're in the safer at home phase, but at this point we still continue to keep the buildings closed. We have people telecommuting, we have people in the office, folks, if they need to get a marriage license, for example. And I think there's some exceptions in one of the executive orders from the governor, but normally people have to do that in person. But people can schedule an appointment if they really need to interface with someone. And so those options are available. Our planning department is still operational. Where people are submitting building permits and that kind of thing, where it makes sense and where the broadband, the internet is available, we're actually doing inspections via apps and, in this kind of format. So all of the normal things are going on. And even the county commissioner responsibilities. We continue to have our standing meetings on Mondays. We have our work sessions. All of it is televised or live stream. On Tuesday mornings, we have our administrative matters meetings. So just to be aware that we're doing our best to do all of those kinds of things. And we've begun to reopen the campgrounds in our open space areas and in our parks and near our reservoirs and so forth. Let me stop there. And Paulina, I don't know if we want to go back to that first question. I think I can answer that question, and maybe Michelle can back me up if needed.
Yes. So do city regulations mandates trump the county?
Did you say, is it city regulations trumping the county?
Yeah. So I think what the question is, if your city has regulations, which one trumps which? If you do the county.
Okay. Yes. And a little context there. First of all, in terms of county regulations or county public health orders, when the governor issued his executive order on Sunday, April 26th, to transition from stay at home to safer at home, that particular executive order I think it was number 34. He's done up to 55 of them now. 34-page document which provided with specific guidelines. In terms of local governments, and I will get to the question as best as I can, but in terms of local governments, counties, we had three options. One was to do restrictions that were a higher threshold, stronger restrictions. A second was to align with the state guidelines, and a third was to seek a waiver, with the state, if we wanted to make some adjustments. For example, we've gotten a fair amount of input from folks who hopefully their hair salons or their barbershops have reopened, at least transitioning. And the current guideline says that in your workplace, you can only have you can't have more than 10 folks, employees and customers. And some of the hair salons have indicated, well, goodness, we have like a 3,000 or 4,000 square foot salon, and shouldn't it be based on square footage? So there we're working with the businesses, and they're to provide the county with a, I guess it's called a business operational plan, but ultimately we can request a waiver. In the case of Larimer County, by and large, our county standards guidelines have aligned with the state's safer at home guidelines. To get to the question, working closely with the city, I mean, they're actually looking to us for direction. So the county health guidelines do apply to the municipalities, but I don't know really the answer whether or not they can come up with something stronger than we can. But by and large, they are looking to us for guidance, based on the data, based on the science. Michelle, can you add anything to that?
Yeah, unfortunately, I don't actually know the answer. Up until this point, we have not had the circumstance where a municipality has tried to do a order in addition to ours. Up until this point, they've been just following our orders. I know that the city of Fort Collins is considering a order regarding face masks or face coverings. I do not know if it would supersede any county order, but I did just shoot a text message to our public health officials to see if they could answer that. So if I hear back from them while we're still here, I will let everybody know.
And if I may just add to that, and thank you, Michelle, 3 quick points or 2 points in an example. First of all, on the matter of protective face masks, the cloth masks, currently, folks are highly encouraged to wear them when they go out, especially if they think they might be in contact with other people, within that 6 or 12 feet of physical distancing. I know that our public health folks, the county folks, are looking at whether we should require that if you go into a business like a hair salon or Ace Hardware or something like, although they were considered essential, so you could actually go in there even during the stay at home. But we are considering requiring if folks go into a business, customers, they need to wear a mask. Right now, of course, employees need to wear masks. They need to make sure that everything in the business is clean and sanitized, and they're also required to wear gloves. So I wish to make that point, and I don't think we've made a final decision on that, but I know our public health folks are deliberating. The second point I wish to make very quickly, is that the city has a really excellent site. I don't have the multitasking skills to look it up for you, and I don't know if I have it totally in my head, but I'm sure Paulina does. It's the, I think it's something like, if you go to fcgov.com, and just like we have at the top, you can go to COVID-19, but I think they're calling it, what are they calling it? Emergency preparedness and security. And there's an awful lot of information in there, and that might also shed some light on that question. Finally, yes, Michelle.
Sorry, I was gonna say, I just heard back from my source at Public Health.
There you go.
And they said, yes, that municipal orders do supersede county orders.
So there you go. And that would align, I think, with, county orders can be stronger, but not less or weaker than state. And so we have that option as well. And it appears that municipalities have that option also. And I know there's been a lot of discussion about, now that we're safer at home, anecdotally, folks are seeing people out, walking or this or that. and they're not wearing their protective face masks. Thank you, Michelle. The example I wish to give is in terms of an attempt to collaborate with a local jurisdiction or municipality, Estes Park, all our dear friends up in Estes Park. So I think it was, and Michelle could correct me if I don't have the dates right, I think it was March 23rd when the county health department, our public health order, we worked with the Estes Park town board, the town trustees, to basically allow for a phasing in of accommodations up there in Estes Park, and also short-term rentals or vacation rentals. So that was a collaborative decision based on what the county knew and based on a need to, I mean, Estes Park is so totally reliant on tourism, and of course, it's been very difficult, especially with Rocky Mountain National Park closed. So we did allow that for to happen at less capacity and so on and so forth. And yet there was definitely a lot of pushback. I think that is mostly retired folks who are pushing back about, why are you doing this? Just the other day, apparently that's changed as far as vacation rentals go, because the county, the state of the more recent executive order from the governor indicated that vacation rentals, short-term rentals, still could not open up until the end of May. So we had to sort of rescind that, and I'm sure that can be confusing for folks. I'll stop there.
In addition to that website that you were referencing for Fort Collins, it's fc.com/EPS/coronavirus.
Great. Paulina, can you go through the rest of the questions, please?
Yes.
Or the next one?
My first question, and this is from Barb. What is the major differences between stay at home and safer at home? So can you elaborate on those?
Well, I mean, safer at home basically is allowing for the logical and gradual transition to reopening up businesses. I mean, clearly there are still some very serious public health risks out there. And that is why, we just keep hammering away that folks can't just, it's not like we're going back to the way it was, prior to March and February and January. So it is because so many people are out of work, because we're, businesses are at risk of going under, and we're seeing that. I mean, nationally, we have 30 million people that have filed for unemployment insurance claims. So it's a way of transitioning, and the biggest difference is that stay at home, it was very clear that unless you were an essential business or you needed to do, go grocery shopping, for example, you really needed to stay at home. Here, there's a little more flexibility, and as of Monday, for example, non-essential businesses, retail, could do what some people have referred to as curbside commerce. As of yesterday, barber shops, hair salons, and all of that, following that 10-person per work site protocol, as well as other things, they're starting to reopen. So the big difference is it's allowing businesses to begin to reopen on a limited basis. And then on Monday, of course, offices will be able to open at 50% workforce. Still encouraging people to telecommute, still encouraging, and Michelle, I don't know if it's a requirement or encouragement, but older adults or populations that are more at risk, those folks are still being asked or told to stay at home. And so I would say that's the biggest difference. This is in place now from April 27th. It took effect Monday up until May 26th, I believe, a 30-day executive order. And there are very specific guidelines for businesses. There are very specific guidelines for the public in general, as far as best practices and keeping oneself safe. So I would say that's the biggest difference. I don't know if anyone wants to add anything. I hope I've answered
Next
that.
question is,
yeah.
when do we see restaurants and neighbor pools opening?
Restaurants and what?
Restaurants and neighboring pools, like neighborhood pools.
Oh. Well, golf courses are open. No, the answer to the question is in the governor's Safer at home executive order. Many business, and there are different phases here. And in June, we'll go to probably a different phase. Again, depending on the numbers and if there are spikes in terms of new cases or hospitalizations and all of that. But to answer the question, currently under the state's executive order, restaurants, bars, etc., are to remain closed. However, we are in discussions at the local level for example, there's something called the Northern Colorado Restaurant Association. And there are discussions that are taking place to look at what are some best practices and how we might be able to request a waiver or provide business operational plans where restaurants could begin to do some limited dining in services. Right now, of course, restaurants, and hopefully we've been supporting them as much as we can within our means, it's all takeout, right? And it's fascinating that a place like the Rio Grande Mexican restaurant, which some of us know in Fort Collins, I mean, they were closed for a number of weeks. And then I guess recently they opened up. But apparently if you go to these restaurants and they happen to serve adult beverages, you can actually order adult beverages and you get it in a plastic cup or something like that. So we are intentionally looking at what we might be able to do to begin to get our restaurants open sooner than later. That's the most direct answer to that question. As far as neighborhood pools, I don't know if that's covered in, I would think right now they're not open. City recreation centers are not open. Outdoor facilities like campgrounds, county and both city, natural areas, people are encouraged to go out and properly physically distance themselves and enjoy the trails and all of that. But there are, campgrounds, for example, right now what we have is the only camping that's allowed, and that's going to continue to open up, is if you happen to have an RV that's fully self-contained, because the bathrooms are still not open, but gradually we're going to start doing that. I would imagine that right now neighborhood pools are not happening, rec centers are not happening, like the senior center in Fort Collins or the Chilson Center in Loveland, or even the in Estes Park, they have their wonderful recreation facility up there. So I don't know how and when that's going to change, because pools by their nature, a lot of folks come together, and there's I think it creates a lot of risks, and I don't think we're there yet.
All right. So
I hope this is helpful.
I can send out a poll too here in a minute and ask how people are liking this.
Paulina does these great little polls, and I asked you to all just say yes. Oh my goodness, Michelle, I just influenced the outcome of that potential poll. Sorry.
Question is, what is the current thinking about the effect of COVID on county finances?
Yes, I saw that. Thank you, Barb. Well, first of all, last week, I believe it was, and I have the PowerPoint right here in front of me because I anticipated that question. The answer to the question is this. Well, let me back up for a second. So last Wednesday at one of our work sessions, and we will be getting an update, I believe, this Wednesday, Josh Fudge, who is our budget director, and Matthew Behunin, our budget analyst, gave us an update on, at trying to answer this question. While there still remain many, many, many uncertainties, the county, it was even reported in the newspaper. I think we were at that point, and we'll get an update this week on Wednesday, we were looking at a possible reduction in revenue, a sales tax revenue, maybe 9%. And ultimately that equates to about $1.5 million. Oh, the little poll is out. So make sure I'm going to, hang on a second. Yes. Oh, I can't do it. That's right. Last time I couldn't do it either. Paulina, she has so much control and power, she does. Sorry, all of this is very serious, but I think that, adding some levity, some humor, smiling a little bit is really, really important. So counties, especially our county, because over the years, we have always been very, fiscally prudent. I mean, we have good reserves, operating reserves, capital reserves. We're doing the best we can to do right by our employees, like the folks you're seeing here. At this point, we are not considering layoffs or furloughs and those kinds of things. But because the county is less dependent on sales tax, and sales tax is what is getting hammered, right? Folks can't go out and buy stuff or go to the restaurants or those kinds of things. Municipalities are more being impacted by these issues more so. With the county, of our $290 million operating budget for 2020, the year we are currently in, 140 million of that, I believe, comes from property taxes. So a lot of our general fund money comes from property taxes. The sales tax revenue that we collect, none of that, to my knowledge, goes into the quote general fund. The sales tax revenue that we collect is for dedicated purposes, such as open space, such as operating the ranch, such as the behavioral health services initiative that was passed in 2018. So there will be impacts on those revenue streams, but it's less. Recently, Emily referenced DOLA, the Department of Local Affairs, and they put out a survey to all the 64 counties with some basic questions, and we got the preliminary results back, as well as a much more detailed report, which is likely on their website, or I'm sure Michelle is familiar with this. But it shows that based on the answers to the survey, and it was local counties. I think it was 61 out of 64 counties responded. Municipalities like the city of Fort Collins, Loveland, etc. Special taxing districts like the Poudre Fire District, for example. Based on all of those responses, when this was done a couple of weeks ago, the projected loss of overall revenue was, in the aggregate, was about $700 million for counties, cities, and special taxing districts. Of that, the counties, I think, if I'm remembering right, I have it here, but I think the county impact is about 90 million. The municipal impact is much higher, and then of course there's an impact on special taxing districts. So that's a long-winded answer to the question that we will be affected by this, but perhaps less so in some respects, because the money that we take in, from the people, from the taxpayers, a good bulk of that is the property taxes. And I would also remind folks that in terms of our property tax bill, the assessor is sending out notices of valuation in the off year, and now there are various options for people to, if they wish to appeal the valuation, and it won't change unless there was some reason for it to change, from last year. But of course, the residential and the commercial properties, the property valuations, a lot of that is changing because of this current situation that we're in. But I wanted to make the point that of the property taxes on your property tax statement, about 24% of that goes to the county. The bulk of it goes to the school district, and the school district is going to be mightily impacted. CSU and Front Range Community College are going to be mightily impacted, and that's for a variety of reasons. But one of them is because the state is being impacted. There's a 2.9% state sales tax, among other things, and folks just aren't buying stuff or spending money. So I think it was yesterday that the governor issued. He likes to issue all these executive orders, and they're all, as far as I can tell, very necessary. But he issued an executive order to reduce the current budget, the general fund budget, the state budget, by $229 million. So they're targeted cuts, different departments. One of them is $180 million for the Department of Healthcare Policy and Financing, which, among other things, they oversee the Medicaid program, for example. But again, that's an example. That's going to have a ripple effect on us because, you know, if our operating budget is 290 million and we're getting 140 or so of that from property taxes, the other monies are coming from a variety of sources, federal dollars, intergovernmental transfers, you know, et cetera, et cetera. Okay, that's more than
All right,
people
so we've got the
bargained
next one here. So some people are
for.
concerned
Michelle.
about the current practices and that it will harm the immune system and create superbugs. Is this doing more harm than help?
I don't know. I'm not a public health person. I would say that it's the latter. I really don't know about the science related to the mutation of the virus. I know there's a lot of work going on, but I would submit that if you look at the data for Larimer County and for the state of Colorado, the physical distancing and all of these public health guidelines that are in place are making a difference. We would be in a much different place. You know, with the physical distancing, for example, the goal was, and this is based on science and data and best practices, was to try to achieve, and Michelle can help me with this, a rate of, I think we were actually, at stay at home, we were like 75 to 80%, where we were impacting the potential for transmission of the disease because folks were doing what they needed to do. And that was, you know, keeping apart, still staying connected, but physically keeping that distance. With this safer at home, and it gets back to the previous question, in terms of one of the indicators is, are we, you know, what level of distancing are we achieving? And whereas it stayed at home, we were 75 to 80%, the goal here is 60 to 65%. If we were to drop down to 50% or 40%, we could see a surge come back. We could see the spike in the graph. You know, that might not occur till September. We want to be done with this and we want to move on. So that's, I say, what we're doing is helping, is keeping people alive, is keeping people healthier. But I can't really speak to superbugs and mutations. Related to that, for people's information, recently we brought on a medical director, right, Michelle? We brought on within our health department, Larimer County Health and Environment Department, which is referred to as the Public Health Department. Tom Gonzalez is our director. We have a medical director who is mostly focused on clinical kinds of things and medical things. But we brought on somebody by the name of Dr. Chris Urbina, who actually I know from the legislature. And he is now serving as our medical director, Urbina, and I guess he would know more about this question. And if people really want to know, we could try to follow up. But Dr. Chris Urbina is now our medical director related to this COVID-19 matter. Whew.
All right. The next one is in regards to a mandate around the coverings for facial mask in the city of Fort Collins or not. So are we, it's kind of unclear, it's confusing, so.
And Commissioner, I just looked it up, so I have an answer for this if you want me to answer it.
Michelle, I would be honored and humbled if you answered.
So it looks like starting on May the 4th, the city of Fort Collins has issued an order, and you can find it on their website, and I will try to see if I can find a way to put this link into the chat somehow, or the question and answer somehow.
So I just hit it as answered, and you can go in and type in as well. So.
Oh, great. Okay. But starting May the 4th, yes, it looks like there is an order for the city of Fort Collins that masks must be worn. And you can read the full order. They have a Q&A as well regarding everything about the masks.
And when you say wearing masks in public, in other words, if people are taking a walk in Old Town, they need to wear masks. Is that correct?
Yeah, if they're going anywhere that there's expected to be public of some kind, if they're in downtown, or if they go, I don't know if the mall is open, but if they were to go to the mall, those types of locations, they need to have a mask going into any business as well.
And Michelle, at this point, the county, we're thinking about this, right? We're deliberating on this, but we haven't made a final decision. Is that correct?
Correct. You are correct, Commissioner.
So here's a perfect example, friends, where the city is passing a local ordinance that is stronger than what we currently have at the county level. So it reinforces what we answered earlier, thanks to Michelle's help, that indeed municipalities could put something in place that is, that have higher restrictions or stronger restrictions.
Yep. And I just put that link in the Q&A box for this question, so people can click on that link and learn more about the order that Fort Collins has put out.
Thank you, Michelle.
Question here around how this will be made available. So how will the today's recording be made available? And I have a link for it, so I can either send it to you, John, or
and also I'll put it on our YouTube channel. We'll put it up on Larimer County's YouTube channel as well.
And actually, if I may add to that, thank you, Michelle. Maybe since I finally got with our accountability report number 3, that was that hopefully will go out this afternoon. And if you are able to, Michelle, maybe you could edit it a little bit, and where it references this meeting, which of course will be past tense when this thing goes out, maybe you could put in the link for today's conversation.
That's a great idea. I will do it.
Excellent. Okay, we have the results back from our poll. Overall, people are satisfied, and it would be, again, always welcoming your input in terms of, how to make this more useful to folks, but this is what we have at this time. Thank you.
Okay, so a question around the decisions that the county does actually make. So who does Larimer County's decisions impact it? You can't overrule the city, and we keep referring to the state.
Well, if I understand the question correctly, and I'll do my best to be less long-winded, to provide too many details. As I said earlier, with the state executive orders, the state Safer at Home, the counties had 3 options. 1 is to align with the state, 2 is to be more restrictive perhaps, and then 3 is to ask for a waiver to be less restrictive. For example, allowing for restaurants to open up sooner than later, or at least, limited openings. So that's what applies in terms of the relationship between the county and the state. And we've already discussed the relationship between the municipalities and the county. 99% we've tried to collaborate with them, but indeed they've made a decision. That recommendation, that discussion probably came from staff and the city manager, Darren Atterbury. And then ultimately, if it's an ordinance, the city council has to approve that. Just like we get recommendations from the public health director, Tom Gonzalez, and his team, and then ultimately we either pass a resolution or we say, yes, let's go ahead with this in terms of being the elected officials for the county.
All right, so one of the next questions is around camping and how camping is only open to existing reservations, but not to new reservations. Can we provide any transparency around this?
So I would encourage folks to go to our Department of Natural Resources website, larimer.org/ I don't know what it is actually. And in there, if you go, there is a reservation system. And when we first opened up the campgrounds last weekend, it was, again, phased in. And it turns out that the campsites that we were opening up, well, first of all, Larimer County has 400 campsites between everything from Hermit Park, which is on the way up to, which is up towards Estes Park, to the Carter Lake, Horsetooth Reservoir. But when we opened up last weekend, it was on a very limited basis. There were maybe 20 campsites on the south end of Horsetooth Reservoir and 30 campsites over on west side, I think, of Carter Lake. And those were specifically for Larimer County residents who were already had made reservations. And those were also specifically for folks who, as I mentioned earlier, have a hard, what are they called, hard-sided camping facilities like an RV or a camper, where the bathrooms are intact. this weekend, we're starting to expand that. I think we're making available that type of camping up at Hermit Park. So gradually by Memorial Day, more of these campgrounds will be open for new reservations and perhaps less restrictions. We're also moving towards getting some of these bathrooms to open. But again, even that's not easy if you think about it, folks, because we have staff and we have park rangers who go around and just try to keep people safe and everything else. But even on the cleaning of these bathrooms, we want to make sure we're protecting our employees, and we actually didn't have adequate access to personal protective equipment. If you're going in and cleaning out the bathrooms, you want to make sure it's being done in a way that protects the person doing it. So we've actually contracted with a private vendor to help us do some of that. But the goal is ultimately to get the campgrounds much more operational. The boating marina, at least the Horsetooth Reservoir one is open, so folks can put their boats in the water, but the concessionaires, the visitor center, and those kinds of things are not open. At the day use areas, like if you go on Centennial Drive on the east side of Horsetooth and bicycle, drive, or walk or run that, the bathrooms are actually open for those those day use areas. And the trails are open as well. But again, once again, we are encouraging folks to, practice physical distancing. Did I get that mostly right, Michelle? Yes.
Does Larimer County have a way to increase availability of reasonably priced masks, for example, through grocery stores?
I'm not sure I know the answer to that question. Information, I think, related to that question, and Michelle might be able to help us with this. I think it's relevant, and that is that recently we sent a letter, and Michelle can help me with this as well. The commissioners agreed to a letter to send to grocery stores to make it easier for licensed child care facilities, whether in-home or centers, to be able to purchase cleaning supplies and things that they need in order to run their child care centers. So that's an example where the county did have a role. Beyond that, I don't know if anything you could add, Michelle.
I know that the county and usually most of our first responders at this point are taking donations for face coverings. And if someone's in need of a face covering, what we've been telling people is that they can reach out either to the Larimer County Emergency Operations Center, and we'll see if we have some that we can hand out, or reach out to your fire department, your police department. They might have some as well. We know there's a lot of folks in the community that are making masks to donate, so we know there's quite a few out there, but we just gotta find a way to connect those donations to individuals in the community. So I'll put a link in the question to refer you to contact information for our Office of Emergency Management.
Thank you, Michelle. And when you say our Office of Emergency Management, or the EOC, the Emergency Operations Center, in particular, you're referring to the Joint Information Center aspect of that. Isn't that correct? Where people can call?
Yeah, actually for this situation, typically I would be referring to our JIC, or Joint Information Center. But in this situation, I'm actually going to refer to the Emergency Operations Center, because within that, there's a section called logistics, and they are the ones that are kind of handling our supply of materials that we have right now.
And two other quick points I would mention regarding the Joint Information Center, which is connected to the Emergency Operations Center. 10 people staffing that, responding to people's questions. At least one of those people is Spanish speaking. You can also text your questions, et cetera, et cetera. But that number for folks to write down is 970, this is to the JIC, the Joint Information Center, 970-498-5500. And there's a texting number and all that, but again, all that's on the website. The other thing I'll mention regarding this question about masks and things of that nature. Would you agree, Michelle, that the United Way of Larimer County has done some pretty incredible stuff? If you go to their website, uwaylc.org, uwaylc.org, their entire homepage has become sort of this one-stop shop, for donating to our Northern Colorado Recovery Fund, which goes to nonprofits, et cetera, to volunteering, and I would think that they would have a link that might provide some other avenues for securing, the protective face mask. So that's a really, really great site. And while I'm at throwing out websites, I also want people to be aware, and the county had a significant role in this, and it continues to be working with the various partners. But folks in the business community, we have, working with the Chamber of Commerce and other people, we've set up this, it's called NoCo Recovers. NoCo Recovers. The website, I believe, is NOCO Recovers, plural.com. And if you're a business person in particular, gosh, if you go to that site, it's all there. One-stop shop in terms of potential available resources, et cetera. So folks should be aware of these kinds of resources.
Just to add one more thing in there, and you reminded me of this. Thank you, Commissioner.
Yes.
Another way you can reach United Way is just through 211. A lot of these questions too, you can always dial 211, and United Way has someone who can answer a lot of these questions regarding recovery, face masks, resources in the community. That's what 211 is for. So don't forget about that one.
And and overall, the community in so many ways has been extraordinary, not just the folks who work for the different levels of government, but community members have been pretty darn incredible. And I can tell you that the 2 face masks that I wear basically came from my neighbor on the next block who was making them and said, do you need some face masks? And I said, yes, I do. And that's what I'm using, actually. And then I wash it every day and everything else. Are there other questions, Paulina? I'm ready for just easy questions now.
Okay. So would there be any, this is maybe not an easy one, but would there maybe be any opportunity to provide a waiver in order to not have to wear a face mask in public areas?
Well, right now, I think in terms of the new ordinance that the city apparently is enacting, to get such a waiver, you'd want to talk to the city folks responsible for that. In terms of the county, again, if I'm understanding the question accurately, we are not requiring that folks wear face masks out in the public. We are mightily encouraging, recommending, just as is the state. And I know we've gotten some emails and input from folks who I think are mostly retired, saying now that we're at safer at home, at least anecdotally, they're seeing more and more people out and about not wearing face masks. And the question has arisen, can you make people wear face masks? And I said, well, number one, a lot of this comes down to personal responsibility at some point, and the county is not going to be going around with deputies or some code compliance people to somehow enforce. If you're if you're not wearing a face mask, we're not going to be fining people and that sort of thing. That's where we are right now. But at the local level, it appears that to get a waiver, you'd have to check with somebody at the city of Fort Collins.
All right, so I hope I'm not butchering this next question, but are we going to be requiring temperature checks for people who would like to apply for benefits? How is this allowed through privacy and medical information? So I'm guessing from a HIPAA standpoint, and if I'm wrong on that, please let me know.
Sure. So requiring, and the question was, are we going to require screening like temperature checks, et cetera, for folks who are applying for benefits? Is that correct, Paulina?
That is the question, and maybe it would be best if we let the person who's asked it, if they would want to raise their hand, maybe we could have clarification on it too if we're getting this wrong.
It's a very good idea, Paulina. See if that person wishes to raise his or her hand.
And I can jump in here, Commissioner. I know that that has not been a topic of discussion at all, that we would require that. Additionally, right now, I know they're encouraging people that are applying for benefits to do it online anyway.
Yeah.
So I can't, you never say never, because I'm not the person that makes those decisions, but I can't imagine in the near future we're gonna make people applying for benefits do temperature checks.
And actually, spot on there, Michelle. Just add a couple of things. As an example, one of the benefits that's really important for folks who are of lesser means as far as income, and especially in these times, are SNAP benefits, Supplemental Nutrition Assistance Program, or food stamps. Recently, based on the advocacy from the county with the state human services folks and with working with the feds, there's now greater ability to use one's debit card, electronic benefits transfer card, to purchase groceries online. And we're working towards expanding that beyond certain grocers at this point, and also making sure that we're waiving the delivery fees. So people, who have limited food stamp assistance aren't using some of that money to, to pay for delivery fees. But to me, you're right. Most of the stuff that we're doing in the human service world is online or by telephone. The Office on Aging is still doing its work. Our adult protective services folks, our child welfare folks, our people applying for Medicaid. All of those things are still happening. Early childhood, children, youth, and families, but a lot of that is online. What I can say, though, going back to the original, I think one of the premises of the question is that as the county is looking at reopening our buildings, and we haven't made a final decision on when that will occur, we are putting procedures in place whereby employees and people coming into the buildings will, at a minimum, get a temperature check, those things they put on your forehead or whatever. So as we look at opening up the courthouse and the Loveland building and others, we will be setting up a procedure for employees to be checked. If I go into work and I have a high fever, I'll be asked to go home and self-isolate, until that changes. And the same thing with customers that we serve, especially once we start allowing for the people to come in to the buildings.
There is a comment on here from David Lehman. He's a medical doctor, but he was giving an answer to the questions about immune systems. There are many parts to this question. The creation of superbugs mostly occurs from overuse of antibiotics, and mask and social distancing will not increase the prevalence of superbugs. So.
No, and thank you, David. And David is a member of our Environmental Science and Advisory Board, a medical doctor. I think he's retired, and he's been very helpful in terms of providing us with science. He actually did a presentation a couple of weeks ago virtually, and I think it was probably related to this topic. I wasn't able to participate, but I guess I should have. And maybe that's something we can follow up with David and Dr. Chris Urbina to find out, what the current science is related to, any type of vaccine. Of course, when we talk about vaccines for viruses, that's different than a bacterial infection, of course, but the potential for superbugs, based on treatment, I suppose exists, but we could get more information, or maybe David, we could, your presentation, maybe we can make that available to folks. It's a good point.
There is another question. Oh, sorry. There is another question around Larimer County employees and Larimer County employees being tested and testing positive for COVID. how many employees have tested positive, and what is the difference in people being allowed to, being required to be sent home versus, and staying home for 2 weeks versus actually being tested positive for COVID.
So, to my knowledge, in terms of Larimer County employees to date, and Michelle will help me with this as well. I'm glad you're on the call, Michelle, on this meeting. We've had one employee testing positive at our community corrections facility. As you know, we have one of the best county-run, operated community corrections, halfway houses, et cetera, residential, treatment programs, and all of that. There was, well, actually, it was actually a resident that tested positive there. And we took all the necessary precautions as far as that person self-isolating, checking all the employees at community corrections. But to my knowledge, Michelle, correct me if I'm not representing this accurately, we have not had any county employees at this point test positive.
Actually, Commissioner, we had one this week test positive that we know of.
Thank
and
you.
then I believe the question kind of got into details about our HR policies around letting county employees take leave for COVID related things. And I don't think this is probably the proper place to get into those questions right now, but I do think it's important to let people know that the county does also have a policy allowing county employees to take sick leave to care for a family member who has COVID as well. So if that was sort of the confusion around that might kind of answer that person's question as well. But we had one employee test positive this week, and that's, as far as we know, all we know.
And thank you, Michelle. And I'm actually looking at a resolution waiving county benefits policy. And you're right, we don't need to get into the weeds on this, but this one is to expand the allowable use of sick leave by Larimer County employees during the COVID-19 emergency. And this was updated from the previous one to make some adjustments to make sure that we were aligning at the county level with some federal stuff that called the Families First Coronavirus Response Act. So we are trying to create as much flexibility within our resources and within what the feds are saying to be able to allow people to get sick time and to be getting paid for that. So we have put some things in place. Hey, Paulina?
Yes.
I know there was a question that we somewhat answered on there from, I think it was from Barb, and I think we said we probably need to follow up with the Angela Myers, our Larimer County Clerk and Recorder. But just so people are aware of the details of that question as I remember it, she was asking as an election judge or someone who's going to be participating in the June 30th primary. Remember, folks, we will have a primary election, mail-in ballot election. Colorado has a great track record with that. Most people agree that we did the right thing by putting that in place years ago. But June 30th, there will be a primary election, and there will be people working on the ground to make sure that folks who want to vote in person, or I don't know exactly all those protocols, but I think the question was how are we going to protect election judges and election workers on that day? And I know that the county clerk and recorder is already doing a lot of, even though they're present down there for marriage licenses, we kind of have a really interesting system. And I imagine that's just going to be expanded. But ultimately, that's an example of a question that we really need to refer to the clerk and recorder because they run the elections.
Okay, so Weld County is relaxing restrictions. Is there a risk to Larimer County's medical infrastructure as infections rise in Weld County? And are the additional plans to handle the potential strain? And are there any additional plans to handle the potential strain on Larimer County resources?
Let's see, there were at least 2 questions embedded in there. I will strive to be less long-winded, and the answer to the first question is yes. And there are implications for the level of new cases that are occurring and the deaths that are occurring and the hospitalization rates that are occurring in Weld County. Since we are a region and our public health director, Tom Gonzalez, works very closely with the public health director in the Weld County Public Health Department, Mark Wallace, Dr. Mark Wallace. There's a lot of collaboration going on, especially and certainly in relation to the hospital systems. But yes, there are implications. And in terms of what the county's doing, I mean, one of the things we've already done is to make sure that we have more supplies of, for example, ventilators. We've established at the ranch, the alternative care site, which is intended to help address some of the overcapacity issues which are currently not occurring. Although I think, there are some concerns of what's happening with the hospitals in Weld County. So we are doing things to prepare for the implications of the different approach that the Weld County folks have taken to addressing this. If you look at the data, I think it's somewhat extraordinary, but they are at least at 100 deaths or close to that, with approaching 2,000 cases. Maybe it's more than that. And again, they are doing a phased-in approach, but they basically said on Monday, anybody could pretty much open up and still follow public health protocols, but it's less phased in than what we're doing in Larimer and a lot of other places around the state.
All right. So, and just to clarify, will we be required to get, staff will be required to get temp checks for Larimer County, but not the public, or will the public also be required if they're coming into our buildings?
If folks are coming, customers, the people we serve, if they're coming into, will they be required to have temp checks? Is that what the question?
Yes.
I believe so. Is that right, Michelle? If somebody's
I'm
coming,
not 100% sure on that one.
okay.
I don't know.
But I do know that we're deliberating on that. We don't make we're trying to be really prudent, and this is like most things, it's a balancing act, and here we're talking about life or death issues. So I think absolutely Michelle's right. We haven't made a final decision, but I know there are discussions about screenings, or at least doing temp checks, temperature checks, and certainly on employees. And we'll, before we open up the building, we want to make sure we have everything figured out as far as operations and as far as keeping people safe. And prior to that, we will be able to inform people, if you're going to come to the courthouse to turn in your, building permit or something like that, we're going to tap your forehead and make sure you're not running a fever.
I think that's as best of an answer as we can give right now, John.
Thanks, Michelle. These are all great questions. I hope this is helpful.
Yeah.
You could always ask another question of Emily. She's kind of quiet over there. She's practicing good listening skills, Emily is. Just kidding.
More than welcome to raise your hand.
This has been very interesting.
Good. It's important.
Right. I don't know that we have any more questions at this time. So
Okay. So, and we're almost to the 11 o'clock hour. Let me just make some closing comments if anyone else, Emily or Michelle or Paulina, want to add to that. But of course, always express, my gratitude to you all for caring enough to participate in these things, for asking really, really relevant and important questions. Hopefully this platform, this way of doing public meetings and interacting with you all has value. Let us know otherwise. We are scheduled to do another one this coming Thursday, May 7th, 7:30 in the morning. It'll be interesting to see how that works, that early in the day. We'll continue to, do the best we can to, to respond to people's questions and make sure we're not sowing confusion, just bringing folks together to make sure we're doing the right thing. We need to get our businesses back to, open, and folks need to get back to work, because there's a lot of people. I feel really privileged, to be honest, that nobody's laying me off at this point, and we have some semblance of security at the county, and we're not just having people get paychecks because they're sitting around. We have people like Paulina, who is a master IT person, who is working from her home on a Saturday, to make sure that we get this right. And the same with Michelle, and the same with Emily. So we'll do the next one on Thursday. We'll kind of see where it goes from there. I encourage you to listen to our administrative matters meetings. The next one is on Tuesday, and I've actually invited, you might be interested to know this, and they start at 9 o'clock. And if you go to the website, there's a way to listen or watch it. We broadcast it. But I've invited Claire, is it Bouchard or Bouchard? I think it's Bouchard. She is the Vice President, United Way of Larimer County Community Impact and Engagement, as well as the Weld County Director of Community Impact. I think her name is Melanie something Woolman. So both of those folks are going to be my guests at the commissioners meeting on Tuesday. And I've asked that Melanie, because she's from that other county across the highway, that she call in. We're trying to encourage people not to leave their counties, or if they're going to go outside and play on the trails, try not to go too far. I think the guidance is to not within 10 miles, walk in the park or walk on the trails. But both Claire and Melanie will be at our Tuesday meeting for an update on what they're doing to provide services to, quote, vulnerable groups, and also what we're doing to deal with some of this eviction stuff. It's interesting that no questions came up about that, but we, one of the more recent executive orders of the governor does look at extending the, quote, moratorium on evictions and foreclosures for another month. And it also encourages the state to be involved in helping to, with landlords and tenants, renters, and in mobile home parks, to try to figure out payment plans and those kinds of things. So that's all I have to say. Michelle or Paulina or Emily, you guys want to add anything?
Just one more thing. We got a lot of questions from people who maybe missed how we said we were going to. A lot of people wanted to know how they could get a recording of today's meeting. So Paulina explained this at the beginning, but I know not everyone was here when we talked about it. So she is going to send out the recording to everybody that registered today. In addition, we're going to put it on our YouTube page. And if you want to find Larimer County's YouTube page, just go to YouTube and search for Larimer County, and you'll find our page will be the first thing that pops up.
Oh, is that how you do it? Okay. Yep. Thank you. Paulina, do you want to add anything?
Nope. If there were any questions that we needed to follow up with, they will be followed up with at a later date. We keep I have all the questions in detail, so.
Absolutely. Emily, is there anything else you would like to add?
Just again, a final reminder to complete the census and tell everybody to do the same.
How does one sign up for your weekly Census 2020 newsletter?
That's a good question. Right now I don't have it so that individuals can sign up because
okay.
I think it's more of a stakeholder email, but you have actually led me to reconsider possibly having that available. If I do, it'll be something that we'll put on the Larimer Census website.
And actually related to that, of course, Michelle has a big hand in this. We put out the monthly Larimer County Connection. And in there, like the most recent one that went out May 1st or whenever it went out, there's usually links to the work you're doing, and it makes it easy to go to the Census 2020 site and fill out the 10-minute survey. So that's another great resource. And there is a way to subscribe to that if you go to the website and Spotlight or one of those darn places.
Yes,
so all
I'm
that
glad you
said,
mentioned that.
it is 11 o'clock, right on the money. I wish you all well. Please be healthy and safe. Get exercise, but keep apart. And thanks to my team here. Appreciate you guys a lot.
Thank you, Commissioner.
Thank you.
everybody.
Thank you.
Bye. Bye, Paulina.
Bye,
Bye.
everyone.
Bye, everyone.
Yay, Michelle.
Happy Saturday.
Happy
Bye, everyone.
Bye.